my name is John. I'm going to be your nurse practitioner student today. And for the purposes of this video, to start off, I will be verbalizing my hand hygiene, whether I have gloves on or off. If I've sanitized, I'll be verbalizing that in this video. So again, my name is John L. I'm a nurse practitioner student. I'll be doing your head to toe assessment. Can you tell me your first and last name and your date of birth?
My name is Bryson Guillen. My date of birth is March 7th, 1999.
Okay, and then how did you get here today?
I drove here today.
Okay, and then can you tell me what state we're in?
We're in Georgia.
Okay. And so I have confirmed my patient's identity factors. Can you also tell me if you have any allergies to latex, tape, or any allergies in general?
No allergies to anything.
Okay. And then are you in any pain? Just so that I know, I'm aware of anything.
No, not in any pain.
Okay. And so based off of the questions that I asked, I can see that the patient is alert and oriented, neurologically intact here, and then from overall physical appearance that I'm able to see, they have good hygiene, they are no apparent distress from what I can see, and they appear to be their stated age as well. Okay, so to start off, I'm going to start with assessing the skin. I would do hand hygiene here and put on gloves so that I can touch their skin. I'm going to start here by touching your forearms and then also your legs here. And I'm just checking for temperature, and everything here is normal, warm, and equal bilaterally. And then I can also see, based on visually, I can see that there are no lesions, no bruising, redness, or deformities here, as you know, that I can see visually. And so now I'm going to check their skin turgor, and I can do that. Just relax your hand for me, and I just pinch there, and I can check their skin turgor that way. Still have my gloves on. I'm going to palpate their skull. I've already observed and inspected visually that their head is symmetrical. I don't see any visual lesions or cuts or lacerations or lumps. And now, again, I would have gloves on doing this. I can feel their skull, that they have hair all around. I don't feel any lumps, and everything here looks good on their scalp for this scalp inspection. All right, so now I'm going to be checking your TMJ, and I'll just be palpating. Now I can keep on my gloves that I've had if the patient's okay with that, or I can doff my gloves and do hand sanitizer, which is what I will do in this case. So I have applied hand sanitizer, and now I'm going to be palpating your jawline, okay? So, all right, I'm just going to feel here, feeling their pulse here, equal bilaterally, and then if you can clench your teeth for me, feeling here and feeling here, and then if you can open and close your jaw twice. All right, so there was no abnormalities there, no clicking or rocking or anything, and the jaw moved smoothly without any clicking. Did you feel any tenderness or anything like that while I did that?
No.
Okay. So now I'm going to be testing sensation. I'm going to be using a Q-tip here. If you can close your eyes and let me know where you feel touch or anything, okay?
The right side of my face. Left side of my neck. The right side of my forehead.
Okay. All right. So that was symmetrical there, and sensation is intact. Now we're going to be testing cranial nerve 7. If you can raise your eyebrows for me. Can you smile? Can you puff out your cheeks? All right. And can you also frown? Okay. So the facial muscles are symmetrical and intact. Facial movements are symmetrical. So now I'm going to be inspecting your eyes, your sclera. Can you look at me? So everything seems normal within normal limits here. And now we'll also be checking Perla with my otoscope here. All right. Okay. So, and you can either use an otoscope or you can use a pen light for the otoscope with a light, or your pen light to check Perla. I'm actually going to use my pen light in this case here. Okay. So, if you can just look straight, and I'm going to be shining the light in your eyes, okay? Look straight for me. Alright. And then if you can look at the tip of my light and just follow it, okay? Alright, and there's no nystagmus. Everything seems normal for the Perla part. And then I'm also going to ask you to look past my shoulder, and we're just going to come in. You can follow my pen. Alright, that's also normal. Okay, and now I'm going to be using the otoscope with the light. I'm going to be checking their ears. Now when checking their tympanic membrane, for adults, you're going to pull their ear up and back, and for children, you're going to pull it down and back. So we have the light on here, and yep, that's good, thank you. Alright, so the TM is pearly gray. There's no redness, no cloudiness, no fluid noted on the right side. And the same thing for the left. So that is all normal and within normal limits there. There's no impaction with wax or anything like that as well. So now we're also going to be doing the whisper test and the different hearing tests. And also to note too, for the vision test, once you've checked Perla, all this stuff, you can also do a Snelling test in office to check their visual acuity. Now back to the hearing test. Now you would usually use a tuning fork. I do not have that, so for demonstration purposes, I'm going to be using my pen light, but to do the Rhine and the Weber test, you would be using a tuning fork. We're going to do those two first, and I'll demonstrate how that's done, and then I'll do the whisper test. So for the Weber test, we're going to put the tuning fork on the top of the head here. You know, I would use the tuning fork, and I would ask the patient if they can hear the sound on both of their ears. Now for the Rhine test, I would be checking bone versus ear conduction. I would use a tuning fork on one side of their ear, on the left side, and then the right side, or vice versa. And I would go the bone behind their ear and then the bone in front of the ear, and I can show here. And I would ask for all 4 times when they would need to tell me when they no longer hear the sound or the tuning fork. So that's how the Rhine test is done. Now for the whisper test, I'm going to come kind of behind you. I'm going to ask you to cover your left ear first, okay? I'm going to whisper 3 letters, and then you can let me know what you hear. So yeah, cover that ear, and I'll start. Can you tell me what you heard?
E, F, G.
All right. And then cover your right ear for me. Can you tell me what you heard?
A, B, C.
Awesome. So based on those tests, that is intact there. So now I'm going to be checking the mouth, and I can use my otoscope again with my light to do so. And so if you could open your mouth for me, everything looks pink. There's no swelling of the tonsils, no white, exudate. Can you pull out your, stick out your tongue for me? Thank you. Can you say ah?
Ah.
All right, so uvula is midline. And using a tongue depressor is how I would check the gag reflex. It can also help me check their tonsils in the back of their throat. I do not have a tongue depressor here, but you would use that, place that on their tongue, and ask them to say ah, or hold down their tongue so that you can see the back of their throat. You can also do the tongue depressor with the otoscope for better light and better vision as well. So their tongue is also midline. There's no tremors there as well. I'm going to be checking their nares. So I'm first going to see, are they constricted, swollen? Again, this is for the purposes of a physical wellness exam. So, if they were coming in with sinus problems, I can check to see, if their nares are constricted or anything like that. So I'm using my otoscope again with the light, and I'm just checking redness. And then can you block your left nostril for me and breathe in? And then the right and breathe in. Alright, so bilaterally, both of their nares are patent. Now I'm going to check for their lymph nodes, and I'm just going to have you tell me if you feel any tenderness while I'm touching anything, okay? So we're going to start here, and you just let me know if you feel any pain. We're going to go behind and in front of your ears as well. Any tenderness or anything like that?
No.
Okay. Now to palpate the thyroid, I was standing behind the patient, and I'm going to ask you to swallow while I palpate your thyroid, okay? And if you could swallow for me. All right, thyroid is midline, and it is normal as well. Okay, so now I'm going to palpate for any thrills or heals, the pericardium there, or the precordium, and then palpate lymph nodes here in this area on their left side of their chest. And I'm not feeling any crackles under the skin or anything like that. And when palpating, you want to use a firm hand. You want to kind of use the pads of your fingers there. And you want to make sure it's firm, especially when you have a female patient, for your comfort and for their comfort as well. Let them know anytime that you may be touching their breast, or for both of your, for any patient that you have, whenever you're touching around their groin area, use a firm hand, and make sure that, your hand kind of looks like this when you're palpating. And so there's no abnormalities there for their precordium. Lymph nodes were great. Did you feel any tenderness?
No.
Okay. And then I'm also going to check carotid arteries while I'm over here too. So we're going to do one at a time. Strong pulse. You can check, their pulse there too. But carotid artery sounds, it's equal bilaterally. So now using my stethoscope, I can auscultate, and we'll start with their heart sounds. Now I'll use the diaphragm first, and then I'll use the bell can be used to hear any murmurs after that. So we're first going to use the diaphragm, and now for the purposes of this video too, the patient would like to keep his shirt on, but it is best to auscultate your patients with no clothing in between the stethoscope and the patient's skin. Do all 5 of those points again with the bell to hear any murmurs. Now for the apical area there, or the max, where you can do your apical pulse is where you can listen for a minute and hear it the best there, or the point of maximum impulse. Now I can check their lung sounds can also be heard here anteriorly, and then we can also hear their lung sounds better posteriorly. So I'm just going to listen, have you take deep breath here for me, and then we'll take some deep breaths in the back as well, okay? Deep breath for me. Other one. Another deep breath for me. All right. And now if you can turn your back for me again, it's best to also take with no barrier between the stethoscope, but we'll keep on the t-shirt here. And we'll do a ladder position. I'm not going to have our patient here today do all 6 just so that they don't run out of breath, but we'll demonstrate how you would do that here. All right, so if you can take a deep breath for me. Another one. And you would continue in that ladder pattern, and there's symmetrical here. If you could keep your back to me, I'm going to look at your back again. But everything's symmetrical. The respiration seem even as well, that you can see from observing. A respiratory effort is also normal. So take one more deep breath for me. Yeah, so it's equal bilaterally here. And also I had already observed based on the front of the patient, and it's again better to observe with the shirt off, but there's no barrel chest, there's no abnormalities there. You can also continue your skin assessment when their shirt is off, on their chest and their abdomen and their back and things like that. Now I'm also going to be checking their spine here. You let me know if there's any tenderness. And then seeing if there's any CVA tenderness here. Do you feel any tenderness?
No.
Okay. And then we would also percuss and palpate their back as well. So you let me know if you feel any pain. Feel anything?
No.
All right. And we're good. Okay. All right. And you can also, I also did not feel any aortic pulsations based on my palpitation of the patient as well. So I'm going to have you lay on your back for me with your head there and your feet here. I'll stand up for you. And now we're going to start the abdomen assessment. Okay, so using the stethoscope, I'm going to listen to all 4 quadrants. Now I am going to ask if you could lift your shirt just so you continue your skin assessment here. I don't see any bruising, any lesions, lumps, or anything. I'm not visually seeing anything here. I do want to apologize in advance because my hands and my stethoscope will feel cold, so I apologize for that. But we're going to, so we inspect, we're now going to listen, and you listen for a good amount of time. You want to make sure that in each quadrant you're able to hear your vowel sounds, so don't go too quickly. Yeah. Vowel sounds are norm active. I can also use the bell of my stethoscope to check for vascular sounds on like the iliac artery, the different arteries here around their abdomen. I can use my bell to check for vascular sounds as well. All right, again, you can use the bell to auscultate vascular sounds. So using the bell to listen to their aorta here and their iliac artery and renal arteries as well. There's no bruits for this patient. They're going to be normal. And then also just to note too, you can also use the bell, just how you did the heart sounds, listening for any murmurs with the bell. You can also listen for any bruit in the carotid arteries as well. And so now we're going to be percussing, and I'm also going to be palpating the patient's abdomen here. So there's going to be a soft and a deep palpation. The soft is going to be about 1 centimeter deep, and then the deep will be about 2. And so again, I apologize because my hands are going to be cold. So you just go in each quadrant. You let me know if there's any tenderness. I don't feel any lumps or lesions. All right, and then I would do a deep palpitation and go in deeper. All right, I'm also going to feel for your spleen. Can you breathe in for me? And then for your liver, and I don't feel anything, so that's good. And then I can also percuss and listen for any tympani in those areas as well. And I can check their liver border as well by doing the scratch test. So first, I'm going to just percuss. Stethoscope here, and we're going to do the liver test here. Sorry. All right, and all that sounds normal as well. Okay, and so I'm also going to be checking, inspecting for jugular vein distension. I'm going to be palpating their pulses and looking for any clubbing, any edema, swelling, and checking their capillary refill. So we've already done the tympanic and the carotid pulses, and I'm just going to go down the line. I'm going to do one side for the purposes of this video, but you would check bilaterally. You can do them at the same time, but I'm just going to check the one side here and go down. I'm going to go here to the radial. Popliteal. And then the inside of their ankle. So we've done all 7 there, and everything feels normal. We're also going to check cap refill here, make sure it's less than 2 seconds. There seems to be good perfusion, and their hand is warm. And again, you would do that bilaterally on both hands. You also can check cap refill in their feet, pressing down on their nail bed. Same thing bilaterally as well. And so we're now going to be checking for coordination. While I have the patient laying here, I'm going to check your feet here, and if you can push against my feet like you're pressing the gas, and push against, or resist there. That's good. That checked for muscle strength there on their lower legs. Can you also raise your legs for me one at a time? All right, bend it. Raise it again, your next leg, and bend. All right, that's good. Can you raise your arms above your head? All right, and bend them for me. Okay. And then if you can, you're good to get up and you can sit here next to me. Okay. And so I'm going to have the patient now stand for me so we can check coordination. If you can use your right hand and touch your nose. All right, and put it back down. And your left hand touch your nose. All right, and put it back down. And then if you can close your eyes for me and put both your feet together. And close your eyes. All right, that's good. We're going to also use this opportunity to check sensation. So we checked on their face. We're going to check sensation also for the rest of their body while their eyes are closed. And you can tell me where you feel, the touch, okay?
My right arm. My right knee. Left knee. Left arm.
All right, so sensation is intact there as well. Now, if you can also, we're going to do range of motion. You can turn your hands if you can do your palms up and down. Yep. You can circle your arms around. Let's go back up here. You could lift one leg for me in balance and lift the other in balance. That's good. Do you feel any pain doing that? You put your leg down. Do you feel any pain doing any of those things? Do you feel like your motion is limited or anything like that?
No, I don't feel any of that.
Okay. And so their coordination and their sensory is intact. And then we're also going to do the heel to toe walk. So if you could turn this way, we're going to do a short distance and just walk to that cord there, heel to toe walking, okay? All right, that's good. And so we can sit down here. We would also test their deep tendon reflexes. And for the purposes of this video, I also do not have a reflex hammer. A lot of the tuning fork, the reflex hammer, the tongue depressor are things that are provided by the clinic that I do my clinicals, the office that I do my clinicals at. So those are always there for me to use. So I do not have one here. For the purposes of this video, I'll be demonstrating with my stethoscope, and so we'll be going through the reflexes. We'll start with the bicep, and to do all the reflexes, you also want the patient to be very relaxed, especially for their patellar reflex. You want their legs dangling, so we won't be able to show that here, but you would check here below the knee, and you can tap using the hammer. You can also check the Achilles, which is by their ankle. We're here doing the biceps here, and if you could flex for me. Yep. You can let go. And so I would be able to check, and you want there to be, slight movement there, and then also their tricep, and then we have the I can't pronounce it, brachioradialis. I can't pronounce that deep tendon reflex. I apologize. But after you check all of them, you do that with the reflex hammer. And I've also checked the spine already. I'm going to have you stand up for me one more time, and you can stay right there and bend down for me. I'm checking to make sure that their spine is curved correctly and it is symmetrical. And then we already did our strength test and our range of motion test. And so that concludes our head to toe assessment. You can sit down. There were no abnormalities. The patient tolerated it well. Neurologically, they're intact. And I would complete hand hygiene again, after, finishing the assessment. Thank you very much for being my patient.
Thank you.
All right, so to just add a couple of things at the end of this video, and kind of go into detail about some things. First off, and when you're in office to test cranial nerve 1, you can have the patient smell a scented oil, peppermint oil or orange oil or something like that. For our purposes, if you can close your eyes for me. All right, and then tell me what you smell.
Chocolate.
All right, and then tell me what you smell.
Mint.
Okay, and so cranial nerve 1 is intact. And then I'm going to go back to the vascular portion of the head to toe assessment. So again, you can use your bell to listen for vascular sounds. So you know, we palpated the carotid on either side, one at a time, and you use your bell also to listen. And then when doing the abdominal assessment, we can use the bell to listen to the renal, iliac, and aortic artery there, and then also you can, you know, with the patient's permission, when you're doing the head-to-toe assessment, you can also use the bell to listen to the femoral artery. And then for the deep tendon reflexes, once again, you would use a reflex hammer. For the purposes of this video, I demonstrated with with my stethoscope, but you would do the brachial, brachial radialis. You would do the patellar, you would do the Achilles, and you would do the tricep deep tendon reflexes using your reflex hammer, making sure that the patient is relaxed. And that's really it. I just wanted to add in those couple things.